When I asked to give this talk here, because Mark was recruiting people to give talks, and I said, all right, I've talked a lot about my experience in Haiti, but if I look back on it, one thing I've noticed is how key people have stepped into my life at just the right time, and they've changed the direction of this, and they've made a big impact. So I want to make a point how one person can make a difference in a project, especially if you don't just think about it, but you actually act on it. So I wanted to highlight a few people. So the first one is the founder of Formula for Life, which is the Haiti project at St. Francis. And this is Courtney Shepard. And I think this was around 1996. Do you have it? Okay, yeah, it would have been 2006, not 1996. So approximately 13 years ago. So anyway, Courtney was a biology major and pre-med. And she was a sophomore at the time, and I was academic advisor, and she said she wanted to go on a medical mission trip, and I had no idea how to hook her up with one. St. Francis didn't have anything like this to offer. So she went and found her own trip through a local church, and they went to the Dominican Republic. And on the medical mission trip, she did a number of activities, and I wanted to hear about it when she came back. So she sat in my office and she's telling me about the food they ate, how they drove around, and all of this activity. But then her mood dramatically changed. She started telling me about a young girl who had an infant, and the infant was clearly starving to death. And Courtney said to the mother, "You need to feed your baby, otherwise your baby's going to die." And the mother says, "I can only afford to feed my baby 2 crackers a day." And Courtney's fighting back tears telling me this, and she says, how can I go back to my comfortable life knowing that there are mothers who can't feed their baby and babies who are starving? And there was a lot of silence between us. I didn't know what to say to her, and I said, why don't you do something about it? And that basically set her on fire. And I thought she was going to do what most students would do, which is they're going to get a box, they're going to put it outside of a door with a note trying to collect donations of infant formula and baby food. And we know those things never work. Those boxes sit empty, people throw trash in those boxes. But instead, she started talking about her experience. She started telling other St. Francis students her story. And they started to fundraise. And we wanted to initially fundraise to raise formula for mothers who were too malnourished or for children who had lost their mothers. So from this, we became known on campus as Formula for Life. And Jess was part of this in the very early years. We didn't really know what we were doing. We were kind of wandering around trying to find our fit. And then Courtney and I, pretty much at the same time, came up with the idea of let's do a 5K run. And nobody on campus had done a 5K run. Back then, 5K runs weren't as popular as they were. None of us really knew how to organize a 5K run, which allowed us then to kind of make it the way we wanted to make it, because we didn't have set in our mind, this is how a 5K run should organize itself. So this became a very popular campus event. The campus is behind us, the community is behind us. Here you can see 2 of the sisters, Sister Jacinta, the university president, Sister Elise, racing towards the finish line. So we appreciate all the support. We were raising money for this, but we didn't know who to give this money to. I don't know how connections in the Dominican fell apart, but we didn't have that connection anymore between Courtney and who she traveled with. So we're thinking we're accumulating thousands of dollars. Who do we give this money to? So I'm from St. Henry, Ohio. It's a town of about 2,000 people. And I'm calling my mom one day and I'm telling her our dilemma. We've got money, we don't know who to give it to. And she says, why don't you call Linda? And I'm like, Linda? Why would I call Linda? My last conversation with Linda, I was like in 3rd grade, she was my school bus driver. And she wasn't even the regular school bus driver, she was the substitute school bus driver. And she says, I think Linda travels to Haiti. Well, so I call Linda. And Linda is just so excited to hear what I have to say. And I said, so I've got this money, I don't know who to give it to. And she's like, oh my gosh, Amy, oh my gosh, you are the answer to our prayers. I know exactly who you need to give this money to. And let me tell you about Linda though. So we have Courtney as a person who can make a difference, Linda, person who can make a difference. Linda's very amazing, but she's very ordinary. Like I said, she drives a school bus. She's the wife of a farmer, just high school educated from a small town. She volunteers with the ambulance squad. She is a religion teacher, And from being a religion teacher, she became a youth group leader. And she had just a few dollars in the youth group fund when she took over. And a group of students said, we want to go to Haiti. And she said, okay, and made it happen. Never had gone to Haiti at all. Led this group of students to Haiti, and then another group wanted to go, and another group. She just came back January from leading her 100th group of students to Haiti. She doesn't charge, she just does this because she feels this is her vocation, to take people to Haiti and they find their fit. Everybody in Haiti knows Linda. They call her Mama Linda. She finds her way around, and everything I've learned about how to get around in Haiti, I've learned from Linda. And here we have Linda, who I hadn't talked to in many years, in decades, and she's the one who connects me with the next person, Father Andre Silvestri. So Linda had met Father Andre in one of her trips when she traveled to Haiti. And Father Andre is the son of poor coffee farmers. And oftentimes when the coffee plants were when the crop was very poor, he couldn't go to school. And he'd miss years of school. And by the time he was in 6th grade, he was 18 years old. And he would cry when he would miss all of this schooling. And in order for him to get to school, he had to cross the river 21 times in one direction. And if he walked, it took 3 hours to walk to school. So one year, his family couldn't send him to school. And he had always felt as a young boy from the age of 6 that he was called to be a priest. So he couldn't go to school, and he wrote a group of sisters and told him his problem and how bad he wanted to go to school. And they said, okay, we will fund you your education. You have to move to where we are. So he did. He had to serve as an altar boy. He helped out with the choir, and they took care of his education. So he finished high school. He then went to a university in Haiti. He then got the opportunity to go to university in Canada, has a master's degree in psychology. Then he got a master's degree from Ball State in counseling. And while he was at Ball State, finishing his counseling degree, was when the 2010 earthquake hit in Port-au-Prince. And he had to get back into Haiti through the Dominican and served as a counselor for people who had lost all of their family, who had lost everything. For many years before this, he felt like he was being called to start an orphanage. And when he was in Port-au-Prince and he saw all these children wandering the streets without their parents, he knew now was the time. So he started taking in children. And he had really nobody to fund him. And where he's located, so we've got Haiti here in green, here's Port-au-Prince, and he's located up here in Cap Haitian. And he started taking in orphans, and where he lives, basically this is what the situation of Cap Haitian looks like. A lot of pictures that you see typical of Haiti is people are going around in tap-taps, very crowded trucks that drive up and down the street. Trash is everywhere because there's no place to put the trash. And then there are markets like this where you could buy everything you needed at these markets. And this particular woman here, her product that she's selling is right here on this table, and these are mud cookies. Mud cookies are what are purchased for the poorest families. Those mud cookies are made out of dirt, salt, and oil. And they dry them in the sun, and the poorest families buy the mud cookies because that's what fills the stomachs of their kids. And their kids aren't crying that they're hungry. But the cookies have no nutritional value. You have girls wandering the street, like this girl who looks way too young to have a baby, begging. And she was actually begging me to buy her child for $1. And then children wandering the street, nobody tending to them, completely naked. This child had absolutely nobody around to take care of him. So father started taking in children. This was one of the first that he took in. His name's Robinson, and Robinson was a street boy. Nobody knew his family. He was living on the street trying to take care of himself. And then several children later, he took in this child, Michelle. Michelle was abandoned the day of her birth in a garden, and she has severe cerebral palsy. She was covered with ants when they found her, and she had ants inside of her. And oh, there you are, Jess. So as we made contact with Father Andre and we're raising thousands of dollars here and there, We'd send students down, like this group, and I think this was the first group of students that went down, bring money to Father Andre, and then also bringing him some products, some food, some cups, and so on. And we were able to eventually have enough money so that we could feed the orphanage, all of the kids there, for a year. And with Formula for Life being a nutritional group, I thought that's exactly what I wanted to be able to do. And then sometimes people would say, you know, we're sending down shipments of food. Does it really make a difference? Okay, are you really helping them? Well, yes, we're absolutely helping them. It doesn't make any difference if we can't feed everybody. We're feeding at least a few children. And here's a good example of this. This child is Darlene. And when Darlene arrived at the orphanage, she's a year old in this picture, and she was estimated to weigh only 5 pounds at a year old. She was expected to die. And our shipment of formula arrived. There is a physician who lives near Father Andre who makes this medical peanut butter. I gave her that, and this is Darlene a couple years ago. Father describes her as the miracle of St. Francis, that she is the queen of the orphanage, and you can see what nutrition does for a child. So it made a difference. Even though we can't feed everybody who's hungry, it makes a difference to at least one person. But Father Andre had a dream. And one thing that I think he teaches the students who come with me is to dream big. And over Father's shoulder, we see all of this land that he owned. A family in Muncie had donated $25,000 to Father to buy 15 acres of land because he had this dream to build an orphanage. And as I would go down there with the groups of students, he'd tell us the story. He would take us to the land. Oops, I think I missed a slide. He would take us to the land, talk about his dream to build this large orphanage. We would hear his story, and then another student comes in and makes a difference, Amanda Pedro. She was a nursing student at St. Francis, Bishop Luer's graduate. She played basketball for St. Francis, and she just happened to be in one of my classes. Didn't know anything about her. But when she walked in, I was immediately attracted to her. And I was like, there's something about this girl. So we got to talking, and I asked her if she ever wanted to go to Haiti. And she's like, I guess I could. Can you tell me more? So she went on the first trip, and then she went on another trip, and she kept going on more and more trips. And when we'd go out to Father's land, and I love this picture, we're all looking in different directions. Apparently, I'm thinking something completely different. We're standing out there at his land, we're taking measurements, we're thinking, oh, let's put this building here, let's put this building here. And we would do this year after year. And then Amanda says to me, very concretely and confidently, we're supposed to build the orphanage. And it never occurred to me, it wasn't even in my radar. I was like, wait a minute. We're Formula for Life. We're supposed to supply food for these children, not build an orphanage. But I knew she was right. So we started brainstorming some ideas. Amanda came back to Fort Wayne, and we started giving lots of talks. We just shared our story, and people started sending in money. And within one semester, Amanda had raised $75,000. So we started building this. So we had enough money to get this started. We physically went down, made the concrete block, and keeping in mind, we knew nothing about construction, had no idea how to build anything, how to hire the right people, but everything fell in place. We could hire Haitians to do all of this, and within just a few years, this is now what was that 15 acres of bare land. So this is a drone photo from about a year ago. So here's the residential facility that we are primarily responsible for building. Eventually, it will be a home for 160 orphans. Once we did this, this became a ripple effect. So one person, Amanda, said, we're supposed to build this. And then we did, and other people followed. So for instance, there is a library that was built by a church in Muncie. There's a home for the sisters that was funded by a family in Fort Recovery, Ohio. There's a basketball court right here that was funded by a group in Canada. There is a medical clinic and a guest house that is currently being built. That's funded by a group in St. Henry, Ohio, just from having purse bingos. And then this 2-story school that is pre-K through, I think it's 7th grade right now, and has 300 children from the community going to this school. That was funded by a lawyer in Germany. So one person said, let's do this, and then everybody started following. And there's more things to be built. But we've made a lot of progress. And the orphanage is called Our Lady of Perpetual Help. These are children as of about a year ago who are at this orphanage. So then how did we become a healthcare project? So we started off nutritional, then we started as a construction project, and we're going about what we've been doing every year. I get a team of students. This was my team from several years ago. We put on the 5K run, we raise money, we would send it to Father. And then another student comes into my life, and it's this guy back here, Chris Colby. So Chris Colby was biology pre-PA student. He was homeschooled, and he had traveled to the Dominican Republic several times with his father. And his mother's here in the picture, she's a nurse. His father is a physician assistant. And Chris was very interested in my project. He was helping out with the project. And then one day he says, why can't this be a class that St. Francis students can take? There's so many nursing students at St. Francis. There's so many pre-med, pre-PA students. Why can't this be a class? Why can't we start providing healthcare? And again, that wasn't anything that was in my radar. And I was like, I don't know. And he's like, I've got it all figured out. And he had everything written up. Let's do it like this. We went through all of the paperwork. We went through all of the councils we needed. And it became the first class like this at St. Francis. So the class is biology, primary healthcare in a developing country. And the plan that Chris set up is that students would work alongside alumni who are now healthcare providers. So for instance, when Jess is done in PA school, you're gonna come back and go on this trip, and then pre-PA students would work alongside her. So it gives the opportunity for students to work with our alums. It gives students the opportunity to do more and work closer with a provider than they could in the United States, plus to just see different sorts of cases. So some of the things that we did is first we had to find a hospital to work with. And that's where we came across Dr. Eugene Macklin. And again, this is a man who dreams big. So he's a Haitian trained physician, but he has the opportunity to come to the United States. He's had multiple opportunities to come to the United States to practice healthcare and to make a lot more money. But he wants to help his people, he says. So he independently, before we even knew he existed, he had fundraised for this hospital. And it's a hospital for the poor in Haiti. It's only about 20 minutes away from the orphanage, and it serves a population of 250,000 people. When we had first seen this hospital, it was still under construction. It opened just a few months before we arrived. So we were one of the first medical teams to come to the hospital, and it was immensely disorganized. So I have several students here with me. This is a dentist, primary care physician, and a few other providers in this. None of us knew what we were getting ourselves into. So we arrive, and you can see it's a very rural hospital. The people who are coming to seek care from us have to arrive either by moto, the motorcycles, along very bumpy roads, and you're sick, you've got your family with you maybe on this motorcycle, or they've walked a long distance. Children are free. Adults, he asks $2. And if you can't pay the $2, that's fine too. So as we get closer, there's gates right here. And I kept saying to Dr. Macklin, are you sure anybody's going to come? He's like, Dr. Amy, there will be people. And the way they announce it is they have just a loudspeaker and they're driving through town announcing that there's healthcare providers. They put it on the radio, they announce it at churches. He wasn't worried, I was worried. We get there, here's the gate. They've been waiting for us, and there's so many of them. And here, this gives you, this is one of my favorite pictures, gives you a good idea of what this looked like. So there's obviously no patient privacy, okay? So here we have pre-PA student Courtney Albers. Haitians are very loud people. All of this is very loud, it's very hot, and she has to stay focused on this translator to understand, and I don't even know who her patient is, understand the patient history that she's being given. Plus, everybody knows what that person's got. There is a TV off to the side. Nobody's watching the TV because it's much more exciting to hear what your neighbors have all got going on. So this is what it was like for 3 days straight. We were so exhausted. And we see lots of ordinary and then also very extraordinary things. So this is a picture of Dr. Kate. She's a primary care physician. And what I want to point out in this picture is some of the things that the students learn. First of all, this woman, who's clearly an older woman, is dressed very, very nice. Haitians take a lot of pride in their appearance. She arrived by motorcycle. I don't know what her condition is, what hurt, but Brittany is learning from Kate how to talk to a patient who doesn't speak English. And the temptation is to be looking at the translator. But here you can see how engaged Kate is, and she's just listening to the translator in the background, giving that patient, who she can't understand because the patient's speaking Creole, her full attention. And that's something that really struck Brittany on just how to talk to and look at a patient. And like I said, you get to see things closer and spend more time with a patient and talk to the provider about what they're seeing. I don't know what was wrong with this man. Clearly there was something in his ear that they were looking at, but that's an opportunity, especially pre-PA and pre-med students do not have as an undergraduate. And then Dr. Caldwell here is a pediatrician, classmate of Jess's. What I like about this picture is a lot of kids came in for upper respiratory infections. They came in for the very usual. This child came in because it had a severe burn on its chest. And what had happened is, in Haiti, there's no regular kitchens. They cook on these little open fire stoves. And the mother went into the creek to wash clothes and left her child in the house. And he fell into the stove, the open fire, and burned his chest. But I really like the way that mother is looking at her child there. Wounds that need attention. Lots of sexually transmitted diseases. The most of our patients are women who have some sort of pelvic infections. And Kate was doing so many pelvic exams that she was actually getting a little frustrated. And she's like, all right, Mercedes, it's time for you to learn. And Mercedes is a nursing student. This is her first pelvic exam. And I love how the photographer captured that, like, what do you want me to do next? Like, oh my gosh. So again, you wouldn't have that experience in an undergraduate education. And then nursing student Ashley with a patient who is HIV positive. And you can see obviously that this woman has an opportunistic skin infection, and most women in Haiti are very muscular just from carrying water and all of that, all the manual labor. You can see she has a lot of muscle atrophy there. And sometimes people will comment, shouldn't Ashley be wearing gloves? Well, she's practicing universal health precautions. She's not touching any of the open wounds. But that's something that is culturally important, that we don't wear gloves unless we absolutely have to, because otherwise it can be interpreted as we don't want to touch them. So, seeing several cases of HIV, and then tumors. So this woman here obviously has a neck tumor, and she knew that she needed surgery. She had been to the hospital, but the problem was she didn't have enough money. She used all of her money. She borrowed as much money as she could, and her family gave her money. She didn't ask us for any money. She asked if we could treat her tumor, which we couldn't. And I was talking to the physician, and he said she needs $200 more. I was like, that's it? So we gave her $200 from the money we had raised from the run and sent it to the hospital, and I assume that she now has that tumor removed. Now the next picture, I don't know what you want to do for him, is a very dramatic breast cancer tumor. So, okay, so the first day at the hospital, super crowded, right? And people knew I was in charge of the whole group. And this woman is frantically trying to find me. And I run into her, physically run into her, and she screams in pain. And then she takes out this big tumor that she has. And this is in a case of an inflammatory breast tumor. She had had this tumor for about a year. It was very, very hard. It was very hot. There was absolutely nothing we could do for her. So this is an opportunity. Kate's explaining to Courtney what's all going on, how this developed, and all we could do is get her pain medication and we had to find ACE bandages, and we had to go through everything we had. We found a couple ACE bandages. We basically tied the tumor, tied it so it went behind, the bandage went behind her neck just to take some of the weight off because the weight was so painful for her. We gave her $60, and the $60 got her a ride and a first exam at the next hospital. And realistically, that's all Kate wanted to do because she was like, there's nothing that can be done for this woman other than to relieve her pain. So, an example of a pretty extreme case that we had seen. And then, very young. So these twin boys were only a few days old, and they arrived by motorcycle. And the father is in the background, and the mother, so the father and his two sons arrived on a motorcycle with a driver. He had both sons one in each arm. And we asked about the mother. He said he wanted his babies checked out. He needed food because his wife was dying. What had happened is she had given birth at home. And from what she described, the doctors thought that she had an amniotic embolism, and that was trapped within her pulmonary blood vessels, and she was dying of congestive heart failure. So there was nothing they felt that could be done for the mother. These babies were given infant formula, the father was giving instructions, and every time he runs out of formula, he can come back to the hospital and get more. And then Liz found this boy. There was no parents around anywhere, and she noticed he was very lethargic, and he was just kind of wandering around the hospital by himself. And you can see his distended abdomen, and when you look closer, you can see he had a fever, he's sweating a lot. And she brought him to our attention, and the physician looked at him and said she thought he was very, very dehydrated and that he had worms. That was the reason for his distended abdomen. Worms are very common. So we are going to get him some worm medication. We're going to get him hydrated, but for whatever reason, his mother came, took him, and took off with him, and he left without getting any sort of treatment. And a dentist, the first year that we went. And then this is one that I also like quite a bit. So this girl came because she had heard that there was going to be an optometrist with us, which wasn't the case. She just had misinformation. But we had lots of glasses donated to us. So here, Jana, the student, who's actually a pre-veterinary student, she's holding some new reading glasses. There are bags of old glasses. And Jana only went because she wanted to see goats in Haiti and take care of goats. She is passionate about goats. Do you know who Jana is? No. Oh my gosh, she is crazy about goats. And I said to Jana, I said, okay, this girl needs glasses. Go get all those bags of glasses. So Jana sat there with her. They went through the glasses one by one. Jana made her look at something far, made her look at something close. And eventually she found a pair of glasses that satisfied her. And the two of them were so happy. This girl wanted her picture taken with her new glasses. Jana was so satisfied that she found this girl glasses. So you never know what capacity you're going to be placed in. And then we wanted to do wellness exams on all of the orphans. So we were at the hospital, but then we wanted to do wellness exams on all the orphans. And if they had any sort of condition, they would go see one of our providers. But we wanted to get height, weight, all of their vital signs and start recording this. And also, here we're applying fluoride for their teeth, go through as many of the school children as possible. And again, there's 300 school children. So we're going through these school children, and that second year, the first year we saw about 400 patients, the second year we saw 601 patients. The reason we wanted to start doing these wellness exams was because these children, so there's children from the community and also the orphans, all go to the same school. And these children do not get a lunch because father can't provide any lunch. The orphans get a lunch. Most of children did not have anything to eat that morning either. So we wanted to start tracking this information to see if the children from the community have stunted growth. And if so, use this data to then hopefully fund some sort of lunch program in the future for the school. So that's one of the things that we do as well. And then another person who's made a difference, Dr. Heller, who's sitting out there somewhere. So Dr. Heller, I didn't know who she was, and she teaches psychology at St. Francis. And I was giving a talk, just kind of giving an update of this. And then she contacts me and she says, I don't know why, but I think I'm supposed to go with you. And I'm like, okay. And a lot of people tell me that, and not everybody follows through with it. And she was persistent. And again, I didn't know who she was. So I was asking around. I was like, does anybody know who this Dr. Heller person is? Is she easy to travel with? Is she difficult to get along with? And nobody seemed to really know her because she was new faculty. So she joined, and what she's brought to this now is now we're starting to have mental health care. So with her, she's bringing now psychology students, and mental health is a big problem in Haiti. It's people who have mental health, any sort of mental health, are very much neglected. And part of the reason that they're neglected is because they have to hear from people like this guy. Haiti's described as being about 80% Catholic, 100% voodoo. And we meet with the voodoo priest, they like to be called leaf doctors, every once in a while. And this is one of them that we meet with. They have all kinds of stories to tell. But with mental illness, they make things very complicated. They make you think that you have been possessed by spirits and that you have to have these spirits cast out of you. So people like this really kind of cloud up the environment for mental health care. So Dr. Heller hopefully is going to work through some of that, educate these people, and make some progress in this area. And then, kind of wrapping it up, animals need care too. And in Haiti, animals are extremely important. A goat, for example, costs the same amount as tuition for a child. So if a goat dies and the family needs that goat for milk, for meat, they may have to tell their child, you can't go to school for an entire year so that we can have that money to buy a goat. Okay, and obviously cows are more expensive. Dogs, there's still a considerable rabies problem in Haiti with dogs. So my daughter is pre-veterinarian, and she became interested in this. And she started fundraising and got a couple $100 on her first trip to buy flea and tick medication. And fleas are a really big problem, especially for dogs and cats in Haiti, in tropical areas. And sometimes she'll get the criticism, but you're only given this flea medicine for 3 months. There's all of these other cats. Does this really make a difference? Is it really worth it? And she'll be like, for 3 months, that cat is not itching. For 3 months, it has relief. So from that, we're hoping to make bigger progress. And this year, for the first time, we have a veterinarian traveling with us. So the whole point of this was how one person can make a difference. So we start off with Courtney, who was probably 20 years old at the time, had an idea and acted from it. And there are so many people who I come across when we talk about this project, and they all say, I'm going to do this, I'm going to do this, I'm going to do this. And then the next year they say, okay, I'm still going to do this. And 4 years from now, we're still talking about how you're going to do this. But then there's students who say, I'm going to do this. And that second, they immediately start making calls. They figure out how to get this done. So we've got Courtney. Then 2,000 miles away, we have Father Andre, who has this dream. And here he is, a poor Haitian who is poorly educated, and he has this dream. And then we have a bus driver who connects us, brings us together, and then other students in the story. Chris, who brought us the healthcare aspect of this project. Amanda, the construction side of this. Monica, the psychology portion. And then Olivia, bringing us in veterinary care. So all of these people, nothing particularly outstanding about them, all very ordinary people who are doing extraordinary things. So that's pretty much where I wanted to wrap it up. We're going to continue. This trip is going to take place at the end of May for our 3rd annual medical psychology veterinary trip. And then this was a photo we tried to get, and it was going to be basically, drive safely home. How many people are on this motorcycle? So actually, how many people do you see on this motorcycle? And notice how they're very dressed up. Close. There's 6. So we've got 1, 2, 3, 4, 5, and then Grandma on the back. And if you look at Grandma's other hand, she's holding a purse. So she's got her purse by her side, and she's just barely holding on. So you know, that's typical travel in Haiti. I've never seen this many on a motorcycle, but we were pretty impressed when we did ride up alongside these people. So do you guys have any questions? All right. Thank you, everybody.